Welcome to another episode of Heartcore Junction. Mental health is as prevalent as cardiovascular disease, with over 4 million people in each cohort suffering either mental health or cardiovascular disease. My guest today is Jodi Brown. He is the founder of Mental Mate, which provides workplace mental health workshops as well as compliance support across Australia. He has taught over 14,000 people, and he helps companies meet their obligations under the psychosocial code of practice. He is also a long-distance ultra runner, and he does boxing. He has been the recipient of the Gold Coast Business Excellence Award, and he also volunteers for the SES. Please welcome Jodi Brown. Please advise that we will be discussing sensitive content, and respectfully we will be mentioning the terms of suicide and self-harm, so please, viewer discretion is advised. So welcome, Jodi, to my podcast. It's been really good to be able to have you here with me today, because mental health is a real issue. So before we get started, can you tell us a little bit about yourself and what led you to create the Mental Mate business that you have?
My first wife had, back then it used to be called manic depression. Now it's called bipolar. And so I didn't understand mental health, mental illness. You know, this is 27 years ago. I just thought she was crazy, thought she was a psycho. And so that kind of, we separated not long after my daughter's third birthday, I think. I fell into another relationship, had 2 more children. That broke down after a number of years, nearly 10 years. Found myself using drugs, abusing alcohol, and just sort of spiraling out of control. Recognised I had something going on, didn't reach out for support, probably for nearly 10 years. When I finally did, I was diagnosed with clinical depression, severe anxiety, and just fortunate enough, had some really good people in my life that came into my life at the right sort of time that helped me, like suggested I get some professional support, got me into exercise. So I started boxing, started running, and that kind of got me back on the path to wellness and started, so mental health has kind of been around my circle for quite some time. I've worked for myself for the last 15 years in small business, mostly in the marketing and then training and coaching. And then the last couple of years, it's really spearheaded towards mental health. I'm a senior facilitator for the charity Livin'. And so we go around the country delivering a 45-minute stigma reduction program, talking about mental health, mostly in schools and also workplaces, so mining sites and workplaces. And then over the last 2 years, my wife was 22 years in the Queensland Police Service. She was medically retired in April, so only a couple of months ago, after being diagnosed with PTSD in 2023. And my journey with her on her recovery over the last 2 years and seeing how different organisations handle mental health with their employees and externally as well, it became apparent that there's a big gap. There's some organisations that have been trained in things like trauma-informed care and how to spot the warning signs, how to provide basic mental health first aid, and those that haven't. And the difference is quite dramatic. And so I started looking what options are there, how could I become a mental health first aid trainer or something in that space. And there was nothing that really targeted businesses specifically. And so I created, in help with a psychologist, HR consultant, and a training company, a one-day micro-credential, which is mental health first aid in the workplace, and that also ties in with the new code of practice. And so that's the roundabout story of how Mental Mate got started. So it's very new. I've been in business for a long time, but Mental Mate itself is only about 7-8 months old now.
What an array of life experience that's brought you to that, and what a huge business.
It's been a journey.
Because I know that you've delivered to over 14,000 people, and
Yep.
you say, in businesses it's adults and children, and you mentioned children.
Yep.
So when you're delivering to children, are they receptive? How are you finding the kids in the schools?
Yeah, it's different. All the schools are different. It depends on the demographic, but for the most part, it's been really well received. Living's got a bit of a brand behind it. They've been going for 10 years. And so, we've got lots of T-shirts and clothes, and the branding's really on point. And so it's a little bit funky as well, so that kind of resonates. And then all the facilitators have to have lived experience with mental health or mental illness, and I think that helps us connect as well, because 40% of our young people are currently living with a diagnosed mental illness right now, and it's the leading cause of death for young Australians. So it's something that we've all sort of been touched by, and so the reception's been really good.
Yeah, it's actually on par, isn't it, with I think it's over 4 million people have been living with a mental health disorder, which is very equivalent to cardiovascular disease, which is over 4 million people as well. So it's so prevalent out there. So let's start from the beginning. What is mental health, and what are some of the mental health disorders?
Yeah, so mental health, every single one of us, we've all got mental health. And the big distinction is some of us, some of the time, have mental ill health. It's just like physical health. We've all got physical health as well, but some of us, some of the time, we have physical ill health, break a leg, get a cold, get sick. And mental health, often we mix up mental illness with mental health, but things like depression, anxiety, bipolar, schizophrenia, they fall under mental illness. So which the broad is mental health. And the best way to explain mental health is our mental health sits on a continuum. And if you think down one end of the continuum is green, everything's good, life's well, we can do all the stuff we need to, the stuff we have to do. And then down the other end is the red, and that's unwell, that's the hurt locker. It's really, completely impacting our ability to come to work, to function, even doing the things, the everyday tasks like having a shower and stuff can be impacted. And so we move throughout our lives, throughout our days. I might wake up today and I'm feeling good, have a challenging day at work, get a bit of stress. And if I don't know how to, work my way through that stress, then I can start to tip down towards that, little shaky end of the continuum. And if I still ignore those warning signs and symptoms, I can move then towards that spiraling. And if that hangs around for, a significant period of time, 2, 3, 4 weeks, that's where we can start to look at things like mental illness that might pop up, things like depression and anxiety and other challenges like that.
Yeah. And do you see, is it more prevalent in one gender than another?
It's interesting. It's depending on what mental illness, but it's across the board. Like at the moment in Australia, 9 people every day die by suicide. Now, while 7 of those are male and 2 are female, which, seems to suggest that it's prevalent in males, it's actually, there's a thing called the gender paradox in suicide. And that's where actually more females attempt suicide than males. Males tend to use more extreme ways of ending their life, which is why it's a higher count. It's a mixed bag, to be fair. It's, anxiety and depression anxiety more so affects women, depression more so men, bipolar. It's a mix.
Yeah, because I've looked at the Australian Bureau of Statistics, and it says 21.6% of females were dispensed a mental health medication versus 13.5% of males, which is exactly what you're saying. But I wonder if that's because men don't vocalise their pain as much as maybe a female does. Yeah,
we typically don't reach out for that support. Especially in Australia, the culture is, spoon of concrete, suck it up. And we don't talk about it, and that's still prevalent, especially like those 50 plus age bracket, where that was just the culture, and it still is, especially trade construction, where again even the mental illness and suicide rates are higher. If you're in trade and construction, you're twice as likely as the average guy to die by suicide, just in that industry alone.
That's huge. And even in the cardiac space, if I just take that cohort again of those middle-aged men, and maybe they're a business leader, maybe they're their own business owner, there's so many stresses for them. They're looking after their business, bringing the finances in. They're ensuring that their employees are getting paid, so there's a stressor. Yeah. Then they come home and they've got family stresses. They've got to provide food on the table, pay the mortgage, all those financial stresses, family stresses. Then all they've got to do is turn the news on and there's more stresses of the world, inflation, high cost of living, economics. And when I look at that from a cardiac perspective, you've got this constant adrenaline running, which leads to inflammation because this constant cortisol levels, which is your stress hormone. And if you go way back to the old days, it was that fight or flight sympathetic system would kick in because I've got to run away from the bear or whatever is causing my anxiety. But we can't do that anymore. We still got to sit at the workplace. We still got to sit at our desks. So there's nowhere to escape. So again, going back to that businessman, he's got nowhere to escape. He's just got to keep it together. And it's almost like if he discusses it with someone, it's seen possibly as a sign of weakness. But when they would come, finally, maybe it would lead to a cardiac event. I would notice that's when the breakdown and the onion layers would start peeling and they realise, I've got to look after myself. I've got to be kind to myself,
I've just come from this morning a manufacturing business and one of the guys there was sharing around that. He said it was 10 years before he reached out. He knew, and he was ex-serviceman, so military, and it was 10 years until he actually reached out to get some help. He suffered with PTSD for that period of time, because he didn't want to, he was just too afraid to talk about it. Just all those things, felt weak, felt shame, felt guilt. And no doubt that's impacted. I talk about it a lot as well. Stress impacts your physical. They're not separate. You've got mental health and physical health, but they're actually super connected.
Yes.
You can, like you just explained, stress directly impacts your heart. But mental illness is the same. There's so many aspects to it that's combined. It's not just up here.
So do you feel like the work you're doing, you're almost the catalyst then that allows these men to verbalise and express their emotions? Because maybe if you aren't there, would they actually not say anything?
Yeah, look, I think we're one piece of the puzzle. There's more and more organisations that are doing these sorts of things. I've just recently found out about a couple of not-for-profits that are helping return servicemen and first responders as well. A good friend of mine, Mark McConville, who I've got to introduce you to actually, he's a stand-up comedian, but he's also got a master's in suicidology. And so, which seems like, he talks about comedy and how it's all connected. And he specifically works in that too. But one thing he says to me as well is we'll never know the impact that we have. I could be in a room with 1,000 students delivering the message, and you might, sometimes at the end, they'll come up and say, oh, that was awesome. That, really impacted us. But it's the ones that you don't hear from. And you'll be the same with your, the heart health stuff. You'll never know the full impact that you have on people because they might just take one thing. If it's listening to you talk about the different things they can do to prevent or to minimize the risk of heart issues, they stop smoking. That can change your life. That can change your family. And so, I would love to get more feedback of, how often, I've made a difference. But I just, like Mark says, you just got to know that, you'll be touching so many people, but you won't know the impact down the track.
Yeah, I'm sure you've got that ripple effect going on. Absolutely. Now, tell me about your workplaces. I know you've seen 12,000 people through your course.
Yep.
Tell us a little bit about the content of what your workplaces do.
Yeah, sure. So there's a few different ways that I approach it or that we approach it. Any facilitators I use also have to have lived experience. So I feel that that's what sets us apart, makes us different, is that it's got to be relatable. It's hard to deliver training, especially around like mental health and mental illness, if you haven't been touched by it personally. And so we start with like a 45-minute presentation, which can be a lunch and learn or a toolbox talk. And so this morning at a manufacturing place, that was a toolbox talk. So they just bolted it on to the start of their normal hour-and-a-half meeting and talk about basically getting an idea of what their understanding of mental health. So what I touched on just before about defining the difference between mental health, mental illness. We then dig into some statistics. So like some of the stuff I talked about, things like, 50% of Australians will have experience a mental health disorder in their lifetime. It then starts to bring that relatable because I'll split the room and say, hey, if it's not you, it's the person next to you. So we're all impacted. And every single one of us has a story of somebody in the family, if it's not ourselves, that's had a direct impact either from mental illness or suicide. So it's starting to, and I start by sharing my story, which brings like a bit of openness then. And then we talk about how to spot the warning signs and symptoms of somebody that might be struggling. We then dip into how to talk a bit about self-care. that's one of the most important things, is like what you can do to maintain positive mental attitude, and how to keep yourself down. When I talk about that mental health continuum, down that green end, there's plenty of things you can do to look after yourself. And then how to provide basic mental health first aid, and then where to get support options. And so various things, like if it's a big organisation, they'll have an EAP or an employee assistance program, or referrals to GPs or universities. And so that's your basic kind of mental health awareness. And then I've got longer programs, so half day for teams, and then full day, the micro credential, which is mental health first aid in the workplace, and then also talks about the code of practice. So from November 2024, it's now legal requirement that every business that employs anybody is responsible. We've always been responsible, but now there's a framework on how you have to manage mental health. And so you follow the same path as health and safety as physical health. And so there's like you know it from your medical background, the hierarchy of controls, identifying the hazards in the workplace from a psychosocial point of view. Once you identify the hazards, apply the risk matrix and look at, okay, well, how high or low is the risk of this happening, put our control measures in place, and then monitor those controls. And so part of the course is digging into what the requirements are. So it then helps the business become compliant. It's not only a good thing, because Deloitte have done a study, every dollar spent on mental health returns $2.30 in increased productivity and decreased absenteeism.
Wow, that's huge.
Yeah, it's massive.
So you talk about your psychosocial code of practice.
Yep.
Is that every organisation, is that a digital platform that they work through to be accredited? How does that work?
Yeah, so Workplace Health and Safety provide a tool. So the very first step is a psychosocial risk analysis or risk assessment, and it's like a 40-page document provided by Workplace Health and Safety. You can download it, work your way through it. I consult to businesses doing those risk assessments. They can do it themselves, and a big part of it is you've got to do it in consultation with workers. So I'll sit down with the business, interview all their team, asking questions based on how the code should be implemented. Once that's put together, we then come up with recommendations, and typically recommendations will be train your leaders and managers in basic mental health first aid. And then it might be employee wellbeing programs. It might be looking at giving employees more flexibility around their working time, giving them time to exercise. So some organisations have got gyms now in their workplace, and it's like a mandatory half an hour a day is you have a gym break. And things like that.
Great.
So, yeah, it's some
Fabulous.
forward-thinking organisations doing that. And then, that's kind of the code in a nutshell. It's really just being good humans, looking out for our team, minimising the chances of, psychological injury. They're always going to be present because, things like bullying, harassment, low job control, poor change management, all of these things are always going to be there. It's just making sure that we're, putting control measures in place to minimise those risks.
Can you explain the term mental health first aid?
Yep.
What is that?
So just like physical health first aid, you're going to get your first aid certificate and you're learning all the basics on, the minor things that can go wrong. It doesn't go too deep into, I need to know how to perform surgery or do stitches to do first aid, but it's basic level. Yep, wrap it. If it's CPR, it's X amount of compressions, and I know you've taught me a third of the depth of the chest.
Yeah.
So that's first aid from a health, like a physical health. Mm-hmm. Mental health first aid is similar. So it's recognising the warning signs and symptoms of somebody that might be either having an acute mental health episode, or that might be starting to struggle and heading down that path towards mental illness, and learning some basics. So for an acute crisis for mental health, it might be just breathing techniques. So things that I know would cross over for heart health. So things like diaphragmatic breathing, box breathing, things that kick in the parasympathetic nerve system to, lower that fight or flight in the moment. It might be the sensory 5, 4, 3, 2, 1. What are 5 things you can see? What are 4 things you can touch? What are 3 things you can taste? 2 things you can smell, and to bring them back into the moment. So it's techniques and tools, practical tools on how to manage mental health, and specifically in the workplace as well. And so through performance management and things like that too.
So vital, isn't it, nowadays to do that? You did a workshop and you were talking about the early warning signs of distress, which was pause, support, refocus framework.
Yep.
What is that?
Yeah, so that's in the performance management context. So this was a business that 90% of their workforce is under 25. And so a lot of that under 25, some of the team were not playing the mental health card, but like using mental health as an excuse to avoid the performance management chats or the conversations. And so the pause, support, reflect is basically you've still got to have those conversations. So if I'm the manager, and this is a retail outlet, so a clothing retail, if I'm the manager and you're a team member and you're tasked to open morning shift and it's been over the last week, maybe 3 times you've been late, and then it's time for a performance review conversation. And so we sit down and I'll say, hey, what's going on? And you might share, oh, look, I need to surf for my anxiety. If I don't get my surf in, then I'm anxious and I just can't function. And it's like, okay, I understand that. And so here's where the manager, and this is what the 90-minute training was for, is they didn't know how to proceed past that conversation, how to have, when they said about the anxiety, they're like, oh, okay. And then they didn't raise the fact that they were late. And so it's about just bringing it back to the KPI. And so you're just pausing, letting them know, sorry to hear that. We've got access to support. Would you like me to organise an appointment with our EAP, with our Employee Assistance Program? We still need to have the conversation about you being late those 3 times and the impact that it's had, which is we missed the morning rush, and then I might say something like, depending on the business, but it might be like, I understand that that's good helps your anxiety. How about we swap your shift with Sam? And so you start at 11, he can do the openings instead. How would that work? And then that's kind of the way that we
find some solutions to discuss and find a good common way to move forward for both employee and employer.
That's right, because ultimately everybody's responsible for their own mental health. But as a business, you're hired to perform certain roles and tasks. And if you don't meet them, regardless of the reason why, there still needs to be performance management. It's called reasonable management action. Yeah. And so that still needs to happen, but it can be done in a caring and supportive way as well, where everybody's moving forward. You've given them the option for support if they need it. Where applicable, given them opportunities to change the way their work schedule looks, and then providing a path forward. It's okay, let's see how you go over the next week. With the late start time, we'll see if we can get you back on track.
So what are some of the red flags that people can look out for and to support each other in, say, somebody going through a mental health breakdown?
Yeah, so some of the main warning sign or symptom of somebody that might be struggling is any change in behaviour or character. So typically, your friends, your co-workers, the people around you, and you'll notice a change, something in them that wasn't present before that stands out. And it's usually a feeling you'll get. You're like, something's not right about, John. I don't know what it is. Sometimes it's a lot more obvious. They might be having anger outbursts. They might be, if they're normally fairly like melancholy and suddenly they're over the top a bit more, that can be a sign as well. Could be dramatic weight gain, could be dramatic weight loss. So anything that's a change in their character or behaviour, lots of turning up late, absenteeism, things like that start to come in over a period of time. These are all possible warning signs and symptoms of somebody that might be struggling.
And we really need to reach out, isn't it, and say, are you okay?
Yeah. And that's the very first step. And Are You OK Day, they're an awesome organisation. I think we get stuck on that one, Are You OK? Their website actually is fantastic. They've got video conversation guides and how to have those conversations. But the very first step, is just asking, are you okay? And typically, like in Australia as well, that response is almost rhetorical. It's like, how's it going? Yeah, all good. Or, all sweet. All right, I'm okay. But one way to move past it is to simply ask the same thing again, but kind of pause first. So you'll ask it, are you okay? And they'll go, yeah, I'm okay. Hey, what's really going on? So you're asking just in a slightly different way, gives the person a chance to pause and reflect, and then they start to talk. If still they don't after that second, hey, what's really going on? No, I'm okay, is to just point out gently, kindly, depending on the context, in private, is just point out with compassion of what you've noticed. And that might be like, hey, Alex, I've noticed over the last couple of weeks you've seemed a bit flat. We went out the other night with the crew for drinks, and you had a few more than you normally do, and I saw you got a bit wild. I'm concerned and love to have a chat. How about we go for a walk, or let's go grab a coffee?
And you know what? If somebody actually said that, it feels like, yeah, you are taking the time and you're concerned about me. So I think that's a great way of like we always disregard the first, yeah, I'm fine. But for you actually just digging that little bit deeper actually does feel like I can feel that compassion now. It's great, isn't it? Just to be able to break the ice and just dig that little bit deeper to ask if somebody is really, really okay.
Yeah, absolutely. And like even with suicide prevention, the very first step with suicide prevention is asking somebody directly, are you thinking of taking your life? It sometimes seems counterintuitive that we should, hey, you don't want to put it in their minds if they're not thinking it. But research has shown that that's not the case, that, if you're coming from a good place, it's highly unlikely you're going to make it worse. And so if you've got a friend that you think might be self-harming or thinking of ending their life, the best thing you can do is ask them straight out.
It's interesting you say that, because in the cardiac sector too, we've always had this anxiety, depression screening form, and where we get people to tick in the last couple of weeks, how have you felt? There's always a question in there too of, have you ever thought of self-harming or in any way? But only by asking that question and having that form do we see that, yes, people do tick that. But if we hadn't have asked that question, would they have brought it out? I doubt it.
Yeah, that's right. It's and look, it's not an easy question to ask somebody. Unfortunately, I've had to do it a number of times, and a few times the answer's been yes. And if that's the case, you do have to take action in that moment. There's a couple other steps. Do you have a plan is kind of the next question, because you're wanting to see how far along they are thinking about it. But just considering it doesn't necessarily mean they're wanting to, but if there's a plan in place or they have the means, then it's definitely taking some action time.
Yeah, or they've visualised it.
Yeah, if it's become ideation, then it's time to do something about it.
So what are some of the techniques you recommend for people coping with, say, anxiety or depression? And we did mention, and I heard you mention breathing.
Yeah, look, the top three things, and it's very similar to the heart health, I'm sure, and that we've talked about. A lot of it centres around exercise. The number one thing you can do is exercise. You'd know better from a medical point of view, but it kicks off the good endorphins. It's very hard to feel bad after a good workout or a run. Or whatever it is for you. And that's the thing, it's got to work for you. I love long distance running, so I'll run 10, 20, 30 kilometres. That's definitely not for everyone. Some people just love walking their dog, 10 minutes down the road, turn around and come back. So exercise on a daily basis, minimum 25 minutes, is like everything kind of centres around your exercise, especially anxiety. It's burning off a lot of that, the cortisol and the stress hormones by just thrashing it out in the gym or running. And then the next thing is mindfulness or meditation. And so controlled breathing, box breathing. Box breathing is good for that deep, slow, really resetting. And the diaphragmatic is good for the stress, for the immediate type reduction in symptoms.
Can you just go through the box breathing for us? What does that mean?
Yeah, so box breathing, it's literally like drawing a box. And so you'll breathe in for the count of 4. You'll hold your breath for the count of 4. You'll breathe out for the count of 4. Hold your breath for the count of 4, breathe in, and then just go around like that for as long as you want. The longer you do it, the better you feel. And if you start yawning, it means you're doing it good. And
it means you're kicking that parasympathetic in, aren't you?
That's right, yeah. So I had it this morning. 2 of the guys started yawning. I said, that's good. That's what we're looking for. And so to keep that going. So, and mindfulness, especially if you're like overthinking. I'm an overthinker, and I know there's a big percentage of the population that overthink as well. And so mindfulness and meditation really help with that. And so mindfulness is just being in the present moment without judging what's happening. And so, a lot of people go, I can't meditate, I can't stop my thoughts, can't shut my brain off. You don't have to worry. Nobody can do that. It's virtually impossible to stop thinking. The trick with mindfulness is to just let those thoughts come and go as they float up, acknowledge them, and then just let the next one come along and keep going. So mindfulness, and then social support is out of the top three is the exercise, mindfulness, social support. So having conversations with trusted people that are non-judgmental and are good at active listening.
And having that support, isn't it? You've got to have that connection, whether it's your colleague, some member of your family, reaching out to your GP, getting under a mental health care plan, just being able to reach out is huge. And just when you talk about the that we're all leading in our heads, that's so true. And we all are a lot of thinkers. And lifestyle today is we're constantly in our heads. But I for myself, I try and focus not on my head and in that meditation, and I just focus on my heart. And by concentrating on that, yes, you get all these millions of thoughts, but by letting them go and just concentrating on your heart sort of gets me into my parasympathetic system.
Yeah,
just
absolutely.
to try and relax.
Yeah.
You know? And nature. Love nature. And for you, it's running, and I know there's no way I could run 20, 30 kilometres. But for me, it's like nature, just being able to walk along the lake and the trees and the swans, and it's just beautiful, just creates that grounding mindfulness for me. So I know exactly what you mean.
Yeah, self-care, and that's the thing. Self-care is for you, and it's not selfish. It's something that you really need to consider and do for everybody, but it's different too. Like, you've got to do what works for you, you know. And like you said, you might not like running 20K, but that doesn't mean that so it's not for you. But then for others, they're like, yeah, that sounds really awesome. And so you've just got to find what works for you.
And are you seeing substance abuse as a form of a technique for coping, like smoking, vaping, marijuana, or illicit
definitely.
drugs?
Yeah, drinking, alcohol would be the big one. That's, you know, and it's almost just thrown around. Like, I asked self-care this morning at the manufacturing place, and one of the guys said, we talked about self-care. I said, what do you do to relax? And he's like, drink a six-pack. And that's, you know, that's a big part of our culture is alcohol, unfortunately. And then, substance abuse as well. So probably predominantly cannabis, but then also into some of the other harder drugs as well, depending on the person and the demographic.
Yeah.
Anything. I mean, I was like that. I just, whatever I could get my hands on at the time, whether, there was cannabis, there was a bit of cocaine, there was other stuff as well, just to escape, you know, anything that was going to help escape reality.
Yeah. And my cardiac brain's just going, oh, another cardiac risk factor, all those substances, smoking, drinking.
Yeah.
You know, it's like, no, don't do that. So our businesses are so intertwined. I love it. You went to Vanuatu and you said something like giving is selfish.
Yep.
Yeah. Can you explain that? Because I know you do a lot of volunteering.
Yes.
And you volunteer for the SES.
Yep.
You volunteered in the police exit force
Still do that
as well. Still do
the
that.
exit program. Yeah.
You've also been awarded the Gold Coast Business Excellence Award. Congratulations.
Oh, thanks. That was a while back, but
Yeah.
Yep.
But tell us about your trip in Vanuatu.
Yeah, so that was a retreat that we ran for a group of leaders. So I think we took 50 or 60 people over to Vanuatu, and with the purpose of like personal growth, personal development, doing all kinds of leadership type things. But one of the things we did was a giving back day, and so prior to going over, we collected donations from the local area for schools, and so we had like workbooks and, you know, pencils and soccer balls and all that sort of stuff, and we took them over with us, and then we connected with a local school, and we basically helped. I think we repainted 2 classrooms, we set up a soccer field, we built the soccer nets, and just spent that whole day really giving back to that community, and it was for the purpose of showing that, you know, when you give back, and I work with long-term unemployed as well, and I always recommend that they do volunteering, because helping others it's actually like really selfish, but that's a good thing. Giving back feels really good. And so part of that leadership retreat, and anytime we run any of those leadership retreats, a component is always giving back, because it's one of the most fulfilling things you can do. And so, seeing the kids light up, and, you know, then we hung around and had lunch with them, and that was an awesome day, that one.
Nothing better, isn't it? When you give and you can help somebody else in their space through their pain, but by actually giving actually makes us feel good too, doesn't it?
Yeah, big time.
Yeah,
absolutely.
So if you could leave a message to the audience about mental health, what would it be?
is that you're definitely not alone. I think time and time again, when I talk about this stuff and when we ask, like I'll ask groups of people, everybody's going through stuff or has been through stuff. It's none of us are untouched, and I know that it's anecdotally from the 12 to 14,000 people that I've had conversations with along the way, is they're usually touched by either suicide or mental illness themselves or somebody in their family. And once the conversation's been cracked open, it actually brings people closer together. Like if you can just be open and transparent and authentic about those struggles, because I guarantee with heart attacks, people are talking about that. It's not something you kind of necessarily would hide, I wouldn't think. Like you're okay to share that you've had a heart attack or you've had a heart event where I spent a week in hospital and I had to have a stent put in and, but it's a different conversation if it's, you know what, like I had to spend a week at the mental health unit at the Gold Coast Hospital and I was put under a treatment authority because I was in psychosis. We don't talk about it. The more that we can talk about it with our loved ones, because we don't know who's been through what. I'm a bit of a numbers guy and I know statistics around trauma. 60 to 70% of us have experienced a significant trauma in our life. But even our best friends or close relatives don't necessarily know what we've been through. And so for your mental health, I would say talk about it more. Try to apply a non-judgmental listening. So when somebody is opening up, don't judge them for what they're saying, because for you it might be something really small and you might be thinking, why is he carrying on about this? Whereas it's based on their upbringing, culturally, what they've been through, the traumas they've had in their life, the lens they view the world, and it's very different to ours. And that goes for everybody. We're all completely different. And so talk about it more, and just know that, you're definitely not alone. There's so many people out there that have had challenges, and by talking about it brings us closer together.
So are we talking about it more? Are you noticing we're talking about it more compared to 5 years ago?
Yeah, it's
10
getting
years
there,
ago?
I think. It's slowly making progress. Like media still haven't caught up. Anything to do with suicide, they don't mention it, except for that little bit at the bottom that says need help, call someone. It definitely should be brought out more into the open. But organisations like the charities I do some work for, like Living as an example, I think we've talked to 300,000 people having that the destigmatising conversation. And so there's plenty of organisations that are trying to make change for sure. It's way better than it was 20 years ago.
And so anybody that's struggling with mental health issues now, where are some places that they can reach out to?
Yep. So one of the first options you can do is go see your GP. We have a mental health care plan in Australia, which is 10 sessions subsidised by the government, which will give you a referral to a psychologist, and it might cost you $80 to $100. That's the gap that you'll pay. Two of the biggest cost is cost and time, the two biggest barriers for people accessing support. So one area that a lot of people don't know is an option. Most universities have a psychology clinic attached. So Bond University, Griffith, both have psychology clinics that you don't need a referral. So you actually don't need to go to a doctor. You can just walk in and make an appointment, and it's $30 for a session, which is extremely affordable. You'll probably have a training psychologist in the room with a clinical psychologist as well. So, if you can handle having two people in there. But typically, if that's a barrier, cost and time, go to one of those universities because it's almost immediate entry because they've got a long line of psychology students and then clinical psychologists backing them up. So that's good areas to get support if you need immediate support. If it's crisis support, 000, or Google the word suicide. So if it's either self-harm or suicide, make those calls. Otherwise, educate yourself. Black Dog Institute, Beyond Blue. Avoid Dr. Google. Everything, it's like looking up heart stuff. Everything leads to cancer and death. So avoid that. Go to those places that are reputable. So Black Dog Institute and Beyond Blue have got so much research and tools and tips and brochures you can print and distribute in your workplace. Are You OK is a fantastic website. They've got heaps of information. So they're the resources where you can educate. But otherwise, then it all starts with social support and friends and family.
Most important is just reach out to somebody, isn't it? 'Cause,
Yeah.
you've even got the men's shed.
Yep.
It's a great support network for men.
Yeah, Men's Shed. There's lots of other smaller organisations like that. If you've got a substance addiction, places like AA or NA, so Narcotics Anonymous, Alcoholics Anonymous, all those places are places where you can go and get support. There's so many, like jump on Meetup. There's so many different groups, PTSD survivors and ex-servicemen and first responders. There's so many groups out there. You just got to do a bit of research to track them down.
Okay. Great resources there. So I want to ask you a couple of personal questions now.
Yeah, sure.
What is your definition of health?
My definition of health? I think it's making sure that I'm consistently doing the actions that are helping me live a longer life. So for me, exercise is the number one thing for me. I need to do it as often as I can. I try and do it every day. It's
that distance?
Pardon?
That distance?
No, usually about 5K a day. Weekends I'll start doing the longer stuff, but I also lift weights as well, and a bit of boxing. So for me, health would be exercise, would be the mindfulness. So I try and do the breathing and meditation as much as I can. Really watching what I eat. So I'm very mindful of my nutrition. Whether it's, I go through phases, like different dieting and stuff like that. But I always try and make sure that I'm healthy. Hydration, so drinking plenty of water, which is sometimes a challenge as well, and getting enough sleep. That's something I've struggled with recently, especially since my wife's been recovering from PTSD. I've had insomnia for a long time, and that everything is more difficult when you're tired. And so I think sleep, and I'm sure it impacts heart health too, not getting enough sleep.
It does.
So exercise, the mindfulness, nutrition, and sleep for me, the big ones. That's how I define my health.
Which you've basically answered my next question, which was what do you practice for heart health? Which is basically all of the previous.
All the previous?
Yeah.
Yeah. And the more I learn about heart health after having conversations with you, like I'm also now interested in getting that test for what is it again that I'm checking for? The one thing?
The lipoprotein A?
Lipoprotein A.
Yeah. It's a genetic marker, everybody.
Yeah. So I'm interested in like finding more about that as well. But yeah, like I know you say the heart is a muscle that loves exercise, and so I consistently do that too. Like I want to make sure that I live a long life and minimise those risks.
Which you certainly do with your 20-30K, because the heart as a muscle loves to exercise, but it reduces all those cardiac risk factors. It reduces your blood pressure, it reduces your circulating cholesterol, reduces your circulating blood sugars, releases endorphins. It's the be and end all really, and you're doing that beautifully.
Yeah.
So if anyone wants to find you and find out more about what you do, how do they find you, Jodi?
Yep. So you can just Google Mental Mate or go to mentalmate.com.au. All the services and everything's on the website. I'm on LinkedIn under Jodi Brown. You can look me up. There's not too many male Jodis, so if you're looking through a sea of photos, I'm the guy. That's probably the easiest way, through LinkedIn or through the website.
Well, thank you so much for coming today, and thank you so much for doing all the work that you do in this space. I really appreciate all the work you do in this vital space of mental health awareness.
Yeah, thanks. Appreciate it. Always appreciate the opportunity to spread the word. Like I say, if you've heard one thing on this podcast today that's either refreshed your memory or it's something new, is have a conversation with somebody else and share it. That's how we continue to destigmatise the conversation about mental health, is to keep spreading the word about it and keep talking about it, bring it out into the open. So thanks for the opportunity. Really appreciate it. And I've enjoyed each time we've caught up. So thanks.
Thanks for coming. Thank you.
Awesome.
Thanks for watching another episode of Heartcore Junction. Please do the like, share and subscribe. And if you'd like any information, please hop onto my website, heartcoregroup.com. And if there's any topics in health that you'd like me to discuss, just let me know in the website. Thanks for watching.